Thank you so much for having me here today. It is a humbling honor for me to serve as the inaugural chair for the Biden-Harris administration COVID-19 Health Equity Task Force, and we're getting going with that work. I'm also part of the White House COVID response team, and we've begun our work from during transition, and there's just lots of great news coming out of the White House team. We have really ramped up the supply of vaccine that's out there. And every day we're averaging, about 1.7 million folks getting vaccinated in our country. So that's just really tremendous news. As we look out on the forecast, supply is going to continue to increase, which is great. So we want to make sure that when it's your turn for vaccine and you are at yes, that we can connect you with vaccine easily. The vaccines are free. That's really important to know. And we're making sure they're accessible.
Absolutely, absolutely. So a lot of people are curious if they've already tested positive for COVID-19, do they still have to get the vaccine? And if so, is there a certain amount of time that you need to wait to get the vaccine?
So great question. We get this all the time, kind of. So, I've already had COVID-19, the vaccines aren't for me, right? But the reality is, if you've had COVID and you ask the question, do I need to get vaccine? The answer is yes, right? Absolutely. So there's some evidence that if you've had COVID-19, you can get a little bit of potential protection moving forward, but it's really inconsistent how strong that protection is or even how long it might last. Reinfection with COVID-19 is possible, particularly as we all know we're dealing with variants and other things. And that reinfection could be severe. It could be more severe than the first time you had COVID. So it's strongly recommended from the CDC and others that even if you've already had COVID-19, you still get the COVID-19 vaccine. Really important question about how long should you wait to do it? So the reality is, while you're still feeling sick or symptomatic, you really shouldn't. But the CDC recommends waiting up to 90 days to be able to get the vaccine, partly because we think that natural immunity you talked about does last that long, and allows for kind of other folks to get in queue and get their vaccine. So, think about it around, like, set that appointment for just around 3 months after to get that vaccine, but so important to still get vaccinated.
Gotcha. So is there any expectation on how long the vaccine will last? Is it projected to be an annual vaccination, or just what does the vaccine look like in the long run?
Yeah, just another really great question. This is what we call sort of durability of the immune response, right? So when you get the vaccination, how long will your body kind of remember so that it can launch a full scale attack should it get exposed to that virus again? Now, I think people will be aware, like this, there's a lot that we can remark on as far as the scientific discovery getting us to where we are now. What it means is that we're still in that process of data collection to understand exactly how long that durability will be. The good news is that the clinical trials that tested the vaccine, they're coming up on their anniversaries of 1 year. So we'll be able to look at those participants and answer that question definitively. We do think about things like influenza and the flu, where we do have to get regular sort of repeat immunizations. And so it's reasonable to think that that might be where we're headed with SARS-CoV-2, which is the virus that causes COVID-19. But some of the earliest indications suggest that there might be immunity for, around a year. But again, this is real-time data gathering. Just know that all of that work is being really done so we can get those definitive answers. It still remains that getting vaccinated is the best way to keep not just yourself safe, but really your family and our community.
Definitely. So one of the things I was actually kind of curious about is, will the vaccines be effective for some of the newer strains? Because we've had a lot of new strains pop up in the last couple of months. So what does the vaccine look like with some of those newer strains?
Great questions. We are seeing these new strains. Sometimes we refer to them as variants. This is exactly what viruses do. So I want to be clear about that. This is what every virus always does, is tries to figure out ways to mutate, right? To spread itself more effectively. So that's what we're seeing happening. And really importantly, one of the ways you stop the emergence of new variants is by getting everybody vaccinated. So I want to be sure to link those ideas together. The faster and the more people who get vaccinated, the fewer new variants we'll see. So where are we now with the two vaccines that have been authorized? That's the Pfizer and the Moderna. There is some early research there that says those vaccines can still be really effective against those variants that were first identified in the UK and South Africa. So some sort of guarded optimism there. They're also looking at creating booster shots, if needed, to improve protection against those variants or really any of the other variants. But the takeaway is, everything that we have right now says that it's still safer, more effective to get vaccinated, even against these new variants. Best way that we have to protect ourselves, in addition to, of course, wearing our masks, our hand washing, and still maintaining some physical distancing.
So you mentioned the two different types of vaccines, and now that there's a third, could you explain the differences in the different types of vaccines?
Yeah, great. So, everyone is becoming kind of an armchair vaccine expert now because we need to. And these are really good questions to ask, kind of what's the difference between the different vaccines that are available. So at this moment, right now we have two vaccines that are authorized by the Food and Drug Administration. That's important. That's the Pfizer and the Moderna vaccines. Both of those are what we call mRNA vaccines or messenger RNA vaccines. And both of those work in really the exact same way. Now, what we have is hope for a third and maybe even more vaccine, but the Johnson and Johnson vaccine product is getting reviewed right now by the FDA. It's not been authorized yet. Now that does work a little bit differently. So that's what we call a viral vector vaccine. That type of vaccine uses harmless, let me emphasize harmless, adenovirus, just a type of virus, to transport the material, the genetic material for that outside area called the spike protein of the coronavirus. So it's, we're going to see vaccines that work a little bit differently, but still are safe and still are effective. Just a reminder, Pfizer and Moderna, really almost identical in terms of efficacy as well as action. Around 95% symptomatic cases for Pfizer prevented, 94% for Moderna. I just want to flag for everybody as you start hearing different numbers for different vaccines and what does it mean, that we try to do apples to apples when we can. With the Johnson and Johnson vaccine, their outcome was a little bit different. So in that case, it wasn't symptomatic cases. We're talking about severe cases. And that product seems to prevent 85% of those severe cases. These are incredible numbers. Starting out looking at these vaccine developments, we were going to be really happy with anything with more than 50% efficacy. And so to be in this space talking about kind of 70s and 80s and 90s is very, very remarkable. Just one last point, Moderna and Pfizer, those both require 2 doses, something called a priming dose and a booster shot. 28 days between your shots for Moderna, 21 between them for Pfizer. But Johnson and Johnson vaccine requires only 1 dose. So the last important distinction potentially for some folks.
So one of the things that a lot of people want to know as well is, while we're working so hard to get everyone vaccinated, once they do get vaccinated, and as you mentioned, some people get 2, some people would just need 1 if they get the Johnson and Johnson. What can they do afterwards? Do they still have to wear a mask? Do they still have to social distance? Or can they go back to normal?
Yeah, that's so great. So I often talk about, we all need to get vaccinated so we can get to our new normal, right? I think it's really important. This is a key question as we kind of have all these conversations around science and vaccines, but people really just kind of miss their lives, right? And so how can the vaccination really help us all reclaim our joy, right? I think that's where we're looking at. And people are missing, right, opportunities to go maybe to sporting events, to go to church and faith communities, right, or to see other loved ones. And so it's going to be really important to make sure everybody has a clear sense of all the things that we say are safe. The CDC is working on guidance now, but absolutely the idea is that you can begin, particularly with others who have been vaccinated, begin to create some of those memories that we've all been missing.